For this week's lecture, we will be covering Chapter 2, Anatomy and Physiology of the Speech Mechanism. This is purely a review because you've already had an A&P course previously prior to this class. So the basic processes involved in the production of speech we'll discuss are respiration, phonation, articulation, and resonation. Additionally, for accurate speech to occur, we need to have adequate hearing sensitivity, meaning there's no hearing impairment, and a normal functioning central nervous system, or the brain central nervous system, CNS for short. We will not get into depth about the neurological system because that is covered in a neurological class. In addition, that's more graduate level coursework, so we will only touch on it briefly, but I want you to remember that all of these processes, of course, are controlled by the brain, and if there's damage to the brain, then we will not have accurate speech production. So in the process of respiration, this is your breathing. It is the energy source. So just like you've discussed in physics or chemistry previously, energy is driving everything in our universe, including our bodies and our voice. And when we get to the hearing portion of this lecture, we'll also talk about the conversion of energy when sound enters the ear and how our ear converts that into different energy source for the brain to understand. So respiration is our energy source. It begins in the lungs. It also includes the bronchi, trachea, larynx, the air passageways of the pharynx, nose, and mouth, the rib cage, the diaphragm, and associated structures. You have extensive diagrams in your textbook to review about these structures and how they are controlling our breathing. Excuse me. It's important to remember about the diaphragm, and I always like to do breathing exercises where you place your hand at the bottom of your chest, well, actually about in the middle, right in the middle of your rib cage where the ribs separate. And if you push out on that, when you breathe in and out, you should feel your belly move out and in with your breaths, so that you can feel that diaphragm. And it's important to breathe from the diaphragm for singing purposes, for exercise purposes, and as speech-language pathologists who treat voice disorders, we often have to work with individuals on how to breathe through their diaphragm and not have the typical shallow breathing that we use in conversational speech, because most people are not usually breathing through their diaphragm to produce voice, and it's something we have to be conscientious of. I myself have problems with my voice sometimes. If I lecture for long periods of time, I have to stay well hydrated, and I do have a tendency to lose my voice if I'm overworking it. And so part of the things that I do to try to reduce that is to breathe from the diaphragm and do some breathing exercises. So here is a picture of our respiratory mechanism. Of course, our air enters through the nostrils and it passes through the nasopharynx, which is the passageway that connects the nasal passage and the pharyngeal passage. You have the oral pharynx, which is connecting the oral cavity to the pharyngeal passage. It passes through the glottis into the trachea, excuse me, into the right and left bronchi, which branches and rebranches into bronchioles, each of which terminates in a cluster of alveoli. So these all are working together for us to produce voice, and what happens is that when we breathe in, it gives us the energy we need to, when we exhale, to make the vocal folds vibrate and produce vocal sound. So after respiration comes phonation. Again, we're going to breathe in to have that energy to begin, and as we breathe out, it's producing the energy to make the vocal folds vibrate. It's our sound source. It is an aerodynamic and myoelastic phenomenon. So aerodynamic meaning air, and dynamic meaning working together. And myoelastic, myo is muscle, and elastic is meaning that it's moving back and forth together. So think of elasticity. So all of these processes have to work in conjunction together and be working properly for adequate speech sound production. Again, individuals with voice disorders, which is covered in extensive coursework in graduate school for voice, usually a voice course, we can see individuals who have problems with phonation because of either part of the aerodynamic system isn't working properly or the myoelastic system is not working properly. So sound is produced by the vocal folds of the larynx. It is the source for all speech sounds except the voiceless consonants. So all vowels and all voice consonants are coming from phonation. Excuse me. We have in our vocal folds, of course, they're V-shaped and they move back and forth, produce sound. And this back and forth motion is known as vocal adduction and abduction. Adduction approximates the vocal folds, means it brings it together, and abduction separate the vocal folds, meaning they bring them apart. And you could think of ab as that prefix ab meaning apart, and ad as the prefix of meaning together. So when you see this, they're moving back and forth. This is also, the Bernoulli effect also occurs where the pressure builds up beneath the vocal folds, and when the pressure becomes too great, it has to be released, and that release is the vibration of the vocal folds. So here I will show you a video of vocal fold vibration for your reference, and I will also post this in the module. So there you can see the vocal fold vibration.
Do that soft. More E. Very well.
Now we should see them completely coming together.
Do it loud.
You can see a little separation at the top of the vocal fold here. So this person might be having some voice issues. The vocal folds are like a rubber band where they're coming together and bouncing off of each other. You can see as her pitch changes, the meeting of the vocal folds also is changing. So sometimes they're meeting at the top and sometimes they're meeting at the bottom, depending on the pitch of her voice.
There you go. Do that low pitch. Do that loud.
Again, a little separation at the top.
Do that higher pitch again. Do that loud.
So here is a diagram of the phonatory mechanism. You can see the Adam's apple and the different cartilages that are involved in your larynx that are allowing us to produce these vocal fold vibrations, including the thyroid cartilage, the arytenoid cartilage, vocal ligaments, interarytenoid cartilage muscle, posterior cricoarytenoid muscle, lateral cricoarytenoid muscle, the cricoid cartilage, and the trachea. The next system is resonation or resonance, and it modifies the voice breath system. This is happening in the oral and pharyngeal cavities as well as the nasal cavity. It amplifies and dampens certain frequency components of the speech sound. So this is the reason why we have different frequencies, and one of the reasons why we have different frequencies and pitches in men and women's voices. This is one reason why my voice is uniquely different from your voice, because my pharyngeal cavity is different. Some of you may have had your tonsils removed in the past or your adenoids. These are within the pharyngeal cavity. They absorb the sound as they come in. So when you have them removed, you may notice a difference in your voice resonance because you no longer have those sound absorption mechanisms within your pharyngeal and oral cavities. So this is what gives us our voice quality. In individuals with voice disorders, we can see hypernasality or hyponasality, meaning that they either have too much nasal emissions or they have too few nasal emissions. So think about when you have a cold and you can't breathe through your nose, then you sound stopped up, you're hyponasal, you don't have the nasal emissions on our nasal consonants, which in English are only the and sound. Contrastly, if someone has velopharyngeal insufficiency or VPI, meaning that the flap does not close adequately between the nasal cavity and the oral cavity for speech production, then it can sound like they're talking through their nose, all the sounds come out through their nose. And I have seen this often in children with speech sound disorders, and we see this in children who have organic structural issues such as cleft palate. All right. So here is a illustration of the resonatory system. You can see it includes the pharyngeal cavity, oral cavity, and nasal cavity. And these are the different parts of that. So as you can see, we have the alveolar ridge, which is right behind the teeth, the lips, the teeth, the nasal cavity. Again, that's where our air is coming in and out of the nose. Our palate, including the hard and soft palate. All of these are in the oral cavity. The tongue, this yellow illustration here is the tongue. It includes the tip, body, and root. Our velums in the back, again, that's what closes over our nasal passage whenever we articulate sound to prevent us from being hypernasal. Here is your pharynx and your pharyngeal cavity, and the epiglottis, esophagus, and larynx moving into that laryngeal cavity. The next system is articulation, which shapes the speech sounds. And articulators are within the vocal tract. This is probably the most significant factor in articulation therapy and articulation disorders, because usually we're trying to teach children how to produce speech sounds based on the placement of those sounds and the articulatory and oral cavity. So here is another illustration of the articulatory mechanism, and as you'll recall from your phonetics coursework, we have sounds that are produced in different parts of the mouth, the fricatives, the stops, the affricates, and these are categorized based on their tongue placement, what our teeth are doing, the palate, and all of these mechanisms that we're using to produce these sounds. So we have movable articulators and immovable articulators. Our movable articulators are, of course, the ones we can move: the tongue, lips, mandible, or jaw for short, for common layman's terms, and the soft palate. The soft palate is in the back of your mouth. Again, that's where your velopharyngeal closure is occurring. So you may not typically think of that as movable, but it is because that velopharyngeal flap is closing on non-nasal sounds. Our immovable articulators are the alveolar ridge, again just behind the teeth, the hard palate, our teeth, and our nasal cavity. So here's illustrations of tongues and mouths and oral cavities. You can see this child right here on the top right actually has a tongue tie, which would possibly limit speech sound production, although not definitively. Usually children, even with a tongue tie this severe, can still get adequate tongue elevation. This child here also has a tongue tie. You can tell because it's being pulled in right here, and it should be rounded on the tip. Again, this should not significantly affect speech sound production. There is a correlation between tongue tie and children when they're nursing and their ability to latch onto bottle nipples or the breast nipples when they're breastfeeding. I myself had a child, my firstborn, who was so severely tongue-tied she couldn't latch and she had to have it clip. But my third child is tongue-tied, but he had no problems with latching or swallowing, and so he still has a tongue tie, not as severe as these two children, but it does not seem to be affecting his speech sound production, and it did not impact his swallowing. So for the speech process, you have, again, respiration, phonation, articulation, and resonance. Respiration, the air comes in, it develops air pressure, and that pressure builds up and has to be released, and when it's released it creates the vibrations, which is the phonation and the vibration of the vocal folds. Now what gives us our sound quality are the articulators and the resonators. So how we produce speech sounds are coming in these two processes. If we just relied on phonation, all we would hear would be the same as that vocal fold video. Ah. So we must rely on our articulators to produce speech sound. Now, there are two other systems involved in speech production. Again, I'm just going to briefly touch on this. These are the auditory and neurological systems. So, hearing, auditory system. Why is hearing important to speech? Of course, children learn speech through the sense of hearing what is spoken around them. And normal speech is monitored and regulated for rate, loudness, and clarity through the auditory feedback loop. So sound must enter in, and that we must be able to hear to learn to speak. And of course, we know children who are deaf or severely hearing impaired either need amplification to hear adequately, such as a cochlear implant or a hearing aid, or they need to learn a different communication system, such as sign language. And then on the contrasting side, we have to monitor what we're producing for sounds. And so we must realize that if we say tat, then a person around us may not understand what we're saying because tat is not a word in the English language. And what I really mean to say is cat. So we have to have that self-monitoring system in place. So here is a diagram of the auditory mechanism. You have the outer, middle, and inner ear. Excuse me. The cranial nerve 8, which is the nerve that is receiving that sound and transmitting it throughout the brain for interpretation. The cranial nerve moves it up the neural pathway into the auditory cortex. Again, when the sound enters through your pinna and your eardrum, it's in one form of energy. And when it enters into the middle and inner ears, particularly the inner ear, the cochlea, it has to convert that energy into an electrical current for our brain to interpret through our synapses. And again, this is just a brief overview. You get this extensively in your neurology coursework and also in your hearing system coursework. All right. Now, the neurological system is the nervous system. We have two nervous systems, the central nervous system and the peripheral nervous system. The main one controlling our hearing is the central nervous system. And within these systems, we must hear the sounds as used to initiate, integrate, coordinate, and regulate the movements for productions of sounds, words, and sentences. If we have any damage to the central nervous system, or even the peripheral nervous system. The peripheral nervous system is controlling our automatic processes. So when we breathe, we're not thinking about breathing, we're just breathing on our own. There are things that we do automatically and reflexively that are not necessarily intentionally controlled by our brain. These are the lower brainstem operations versus the upper primary cortex brain systems. So if there's any damage to the central nervous system, then we're going to have, especially in the areas that control speech, you could have inadequate speech sound production. So this could be dysarthria or apraxia of speech we see in individuals who've had strokes or cardiovascular accidents, individuals who've had traumatic brain injuries, other neurological conditions. And here is a diagram of the nervous system. Again, peripheral nervous system is more brainstem. Central nervous system is controlling the upper areas of the brain. We have the temporal cortex, the parietal and occipital cortex, and the frontal cortex. And most of the functions for language are happening in the frontal and temporal lobes of the brain. We have left and right hemisphere functions. Most functions are controlled by the left hemisphere, although the right hemisphere does have some language systems that are controlling, such as prosody, suprasegmental features, affect, facial affect, emotions, in addition to executive functioning and self-regulation. So, in conclusion, what is speech? It's a direct result of muscle contractions innervated by the nervous system, which moves structures in ways that force air out of the lungs, vibrate that air, resonate it, again, give us our voice quality, and break it into speech sounds. All of this is occurring synchronously. We're not individually saying p, b, k, a, I. When we're speaking, we're putting all of these in a string together to produce words and, of course, phrases, sentences, and so forth. So we need to have understanding of how it's working individually, but we're not working these systems individually when we're speaking and producing speech sounds. So speech is a result of successive and simultaneous, continuous, and synchronized interactions of these systems. They are all working together at the same time.